I'm so glad to be back.
Yes, me too.
Guess what? This is what you've been waiting for, Jackie.
Oh, 100%.
The ED episode of Cocktails and Conversations.
Yes.
All right. So we all know what ED is because there's commercials now for it, right?
Yes.
And so we now look at ED as being something that's going to happen to every man. And there's only two kinds of men: those who are concerned about this and those who lie and say that they're not concerned about this.
That's right. Yes.
So what should we do? What's the solution for this? Well, everybody knows that there's oral ED medications that can help.
Yes.
However, those can cause side effects. They can give really severe headache. Sometimes they don't get the job all the way done, and they can be inconvenient too, right?
Yes.
So regenerative medicine now has delivered the ability for us to take growth factors out of a patient's own blood draw and basically fertilize the tissue that we're talking about.
Yes.
How does it work? I don't know if we really completely know. Probably these growth factors stimulate cells that grow new blood vessels and grow new nerves, and that's the way that ED has helped.
Yes.
So even if a patient has mild ED, it's probably one of those things that early treatment is best.
Yes.
I actually had a very famous person that called me just a few days ago, and it would be a household name, who was found out that I was a guru. So
there you go.
It's going to be really fun. I'll be really proud to have that patient
exciting.
Have an experience with my staff who's very comfortable with this.
Yes.
But as we talk about maybe ED just being a normal thing that people should not be embarrassed about, we also should talk about the fact that there are some diseases or some conditions that the P-shot can help for too. And the two things that I can think of is, again, this is an injection of a patient's own plasma out of their own blood draw into the tissue that we're talking about here. And what it does is it not only helps grow things, but it helps scar tissue to relax. So somebody that has a natural curvature they've always had or had an incident of trauma and has a curve, those patients can now get relief. And my favorite story from just last week was a patient that was actually on some type of injections, and those are really inconvenient, and most men don't like the idea of injections into the member. So what this guy said was, my injections are going so easy. They used to get stuck. Can you imagine? And I said, well, that's easy. The reason is the platelet-rich plasma softens tissue, grows new healthy tissue, and makes scar go away. And so that's the reason why the needle is no longer getting clogged up. So anyway, so the P-shot, I've always thought it should be called the PP shot, but that's just me. Most people know what the P-shot is, and if you didn't know what it is before, they know now, don't they?
You know.
And you know
There
what?
you go.
The P-shot, I'm going to say this, the P-shot is for women too. Right? Because what woman wants to be...
That's right, Dr. Lawrence.
Yeah,
That's right. Yeah.
You don't need no husband being sad about it.
Yeah, that's right.
So
we benefit as well.
Yeah. Absolutely. So we have got through a sensitive topic.
Yes.
And we hope that if our folks out there want to know more about it, that they'll give us a call.
Yes.